Some breaking news now. We're following the coronavirus outbreak. A new case in the United States. It's in Massachusetts. It's that state's first. That makes 8 confirmed cases in the United States. The federal government on Friday declaring a public health emergency.
I'd never landed on an intensive care unit where every patient had the same diagnosis. We don't usually have every patient on the unit all ventilated at the same time. You constantly hear the sounds of ventilators. That sound is still playing in my head.
Do the lungs sound diminished? Do I hear wheezing? Do I have an IV starter kit? Do I have a blood pressure cuff? Do I have everything I need in case things could go south?
You see some despondent faces, and then all of a sudden it's just you put on your game face and you go to work and you do the job that you need to do.
When we realized that this was going to be real, that it was going to be big, that it was going to command all of the resources and effort and creativity and intellect and logistical management that we could muster, I think we all paused then and looked up the side of the mountain and felt the enormity of it.
I remember coming together in January when the first threat of COVID was emerging on a global scale, and we started pulling a group together to say, what would we need to do to prepare in the event that this ever became a reality?
We certainly didn't know how long or how vast the experience would be. What we all did know was that it was going to be hard. It was going to be challenging.
This is here. It is real. It's going to be a crisis. We don't know where it's headed, but we absolutely need to be prepared for the unknown.
I remember back in February seeing in some of the media from around the world reports of asymptomatic individuals being capable of transmitting the infection. Well, the moment you say that a person can be asymptomatic with this infection and contagious, that's a game changer.
There was a pandemic around a respiratory viral pathogen. There was also a pandemic of fear. How is the virus spread? Would I be at risk if a patient coughed near me? Will we have enough PPE? What will happen to my family if I get sick? I think there was a whole nother pandemic around that.
The specific event and the specific disease was different from anything we had ever planned for. And so there's definitely anxiety that goes along with that.
What would we do if we didn't have enough ventilators to go around for all of our patients? What would we do if we didn't have enough ICU beds? Why was it that our disadvantaged patients were more likely to get COVID-19? Why was it that they were more likely to die? And what could we do to prevent that from happening?
I remember spending a lot of time saying, do we have a plan to care for those first 3 patients, 15 patients, 40 patients, 220 patients?
Could we make sure that the care that we were delivering, the research that we were doing, was equitably spread to all of our patients?
And then we built that model.
We redeployed a lot of our OR, a lot of our PACU, a lot of our procedural staff to the ICU environment. That was very challenging.
It was a different environment. We were all in a different building. We were on a different unit. Everything possible was different.
I was absolutely terrified. We don't really fully understand everything about COVID. It's something completely new, and the unknown scares everyone. It scares me.
The first patient I encountered in full PPE, through a mask, through a face shield, layers of plastic, it struck me that this patient was also wearing a mask and looked terrified.
Some of the reassurance that I can provide people is just the fact that I'll be there with them.
To be the sole clinician at the bedside when a patient was dying was powerful for them, and they wanted to be there fully for their patients, and they were and they are.
I remember seeing some of the nurses who were incredible on the red team, some of our patients who were right there at the end of life, just sort of petting their heads and saying sweet things to them. And it was one of the most touching moments I ever experienced.
There are many very sad moments of patients dying. There are many happy moments when we were able to discharge a patient, and everything in between. Operation Hope was to really recognize and celebrate every COVID-positive patient discharged successfully from the Brigham, to give them hope, but in addition, to give hope to our providers and our staff and our environmental workers and food service workers. We are discharging patients and they are going home, and there will be life after COVID.
I was in awe of my colleagues for their willingness to care for patients, no matter what the risk might be. It's what we're called to do.
It's about the people, and it's about the support that people give each other. And it's about the dedication, the commitment, and the caring, and that's what it's all about.
I want to be able to look back and say that we gave it our all, that we came together to do our part to bring the epidemic under control. And the good news is I think that's true. We've done that.
So what's important to me is that we take the lessons we've learned from COVID-19 and the gains that we've made for equity and advancing equity, and that we don't lose the ground that we've gained. It is too critical, too important. And as an institution, I am sure that all of us now, today, are more committed than ever.
At the end of the day, when we walked out, I wanted to feel like we had done our job. And that job was different every day. It had to do with staffing and equipment and supplies, but at its core, it had to do with taking care of our community. If we do our job really well in a pandemic, a lot of what we do is invisible to the public. All of the caring professions have had to work together for so long to do things so differently than we usually do them. It was absolutely breathtaking.
Thank you.